Speaker, the previous government initiated the single largest investment in healthcare in Ryde's history when it budgeted $479 million to rebuild Ryde Hospital. I was born at this hospital, as were many locals who live in Ryde. The rebuild is hotly anticipated, and to see construction commencing is enormously encouraging for a community under enormous growth pressure at present. However, an aspect of this endeavour does demand urgent attention. The decision threatens to undermine the very fabric of our local healthcare infrastructure. I speak, of course, about the Minns government's cancellation of the birthing unit restoration following the hospital's reconstruction. This cancellation is a significant blow to the Ryde community, especially considering the immense growth pressures that we are currently facing. With the influx of new residents, it's imperative that we bolster our infrastructure and facilities, not diminish them. The government's rationale for cutting the birthing unit revolves around low demand. They argue that the number of expectant mothers in the area does not justify the cost of maintaining a birthing unit. However, this narrative only scratches the very surface of the issue. We understand that demand is not stagnant. It evolves with population dynamics. As more individuals and families settle in our area, the need for accessible healthcare, including birthing services, will inevitably rise. The government's redirection of expectant mothers to Royal North Shore Hospital, while understandable in some contexts, imposes significant logistical challenges. For those preparing to give birth, particularly in the hustle and bustle of Sydney traffic, such a journey is not just inconvenient, but potentially risky for the health of their babies. The stress of a long journey, especially during peak hour traffic, can lead to complications and increased anxiety for expected mothers. What exacerbates the situation is the need for more transparency preceding this decision. Before the election, there was no indication of such a significant policy shift. Given the rising inflation and escalating costs of building materials, it was always foreseeable that additional funding might be necessary for the birthing unit's restoration. However, prudent financial planning should have accommodated such contingencies within the allocated budget. By abruptly scrapping the project altogether, the prospects of securing funding in subsequent budgets now appears bleak. The palpable distress among local mothers upon hearing this news has galvanised our community into action. We've initiated a petition to reinstate the birthing unit, a powerful testament to our shared commitment to safeguarding essential healthcare services. It's crucial that our collective voice is heard, but also respected, and that our concerns are addressed with the seriousness that they deserve. Reflecting on a broader context, it is evident that Ryde is at a crossroads. We boast a dynamic economy, with Macquarie Park emerging as a pivotal hub for innovation and growth. However, this progress must be complemented by robust infrastructure and public services. We have exceeded housing targets by a significant number, demonstrating our capacity for growth. This rapid growth, while beneficial in many ways, also poses challenges, particularly for the healthcare sector. The cancellation of the birthing unit is just one example of how our healthcare services are struggling to keep up with the increasing demand. Still, such expansion must be accompanied by corresponding investment in healthcare, education and transportation. The recent announcement of additional housing development in Macquarie Park without adequate consultation with local stakeholders underscores this disconnect between government policy and communities' aspirations. While housing affordability is undoubtedly a vital policy priority, it cannot be pursued at the expense of essential amenities and green space. We saw this lack of understanding on display when government considered the North Ryde Common and Macquarie Mental Health Hospital as a solution to their housing woes, a lesson quickly learned. It's heartening to witness the solidarity and activism within our local community, as evidenced by the swift mobilisation against ill-conceived plans. People power has the potential to effect meaningful change, and I urge the government to heed our collective voice. In just a month's time, there is a budget in this state, and it is the time for this government to step up. And here's why we need this critical birthing unit.